A very good evening to all of you. So today we will discuss about septal hematoma. Myself, Dr. Pratikar, your ENT tutor. Let's start with the question. After laparoscopic appendicectomy, patient had fall from bed on her nose, after which she had swelling in the nose and difficulty in breathing. The next step in management is, so basically what the examiner want to ask that after a surgery, patient fall from the bed and he hit on her nose. So that means there was some nasal trauma. After which she had swelling in the nose. So there was some bulging in the nose or some sort of swelling in the nose and difficulty in breathing. So that bulge was causing the difficulty in breathing. So next step in management is, so we all know by looking at the question that after the falling from the bed, the patient developed septal hematoma, because in septal hematoma, this mid part of the nose, that is the nasal septum, the blood got collected in that septum, causing the swelling of the nose, and which will further lead to difficulty in breathing because our airway will be blocked. So what will be the next step in management? Option number A is IV antibiotic for 7 to 10 days. Does it work? I think no. The reason being, septal hematoma is just the collection of the blood in the closed space. So if you give the antibiotics, whether the blood will be absorbed? No. If there any collection anywhere in the body, so answer is we have to drain that. So the first option seems to be incorrect. Now the next option is observation in the hospital. So if there is a hematoma in the nose causing the blockage of the airway, we can't just sit and observe the patient, because this blockage will lead to breathing difficulty and there will be decreased oxygen saturation or decreased oxygen supply to the body. So option number 2 also seems to be incorrect. Now option number 3 is surgical drainage. We all know whenever there is some collection of the fluid, some sort of pus or any blood collection after the trauma, we need to drain that. We can drain either by aspirating with a wide bore needle, or we can surgically incise, put a nick over that collection so that all the blood or any collected fluid will be drained out. So option number 3 seems to be correct one. Let's look at the option number 4. Discharge after 2 days and follow-up of the patient after 8 weeks. Can we discharge after 2 days? No, because this hematoma is causing the nasal blockage or the blockage in the airway. So without doing anything, you can't discharge the patient. Firstly, we have to treat the underlying cause and then after we can discharge. So this option also seems to be incorrect. So correct answer is surgical drainage. Let's understand what is septal hematoma. Look at the picture. We can see the reddish mass. You can see complete nasal cavity is blocked. You can see the reddish mass obscuring the airway, okay, on both the sides. So the patient is having a history of trauma leading to swelling in the nose, which means there is a collection of the blood into the septum as shown in the picture. So etiology may be trauma or some sort of bleeding disorders. What will be the clinical features? Firstly, there will be obstruction, then there will be pain over the bridge of the nose, then there will be difficulty in breathing. Patient can't breathe out properly, so either the patient will open up his mouth to breathe properly. There will be no fever. If only blood is there, there is no any bacterial invasion or any viral infection, there will be no fever. If suppose this hematoma, collection of blood, will get infected by some bacteria or some other pathogens, then this clear fluid will be converted into abscess or pus formation. So in that case, there will be a fever. So septal hematoma, there will be no fever, whereas in septal abscess, there will be fever. So what will be the treatment? If the small collection of the fluid is there or small hematoma is there, we can aspirate with the help of wide bore needle. If there is a large hematoma, we have to do IND, that is incise the wound. We will put a nick over the collection and then drain all the collected fluid. And after that drainage of the fluid, what we will do is we will do the anterior nasal packing so that further collection of the fluid will not be there. Suppose we try to understand, if I put a nick at this place and then incise it, incise, clear all the fluid, and after that what I will do, I'll put a packing to prevent the reaccumulation. So that's all for the septal